Plantar fasciitis is a condition that affects about 1 in 10 people in the United States. But even with how common this condition is, there are plenty of common misconceptions about it. Is it hereditary? Is it caused by being flat-footed? What is the best way to resolve it? Keep watching this video to get some answers about this frequently misunderstood condition. Hi, I'm Dr. Nick Trameri, physical therapist at Full Potential in Holland, Michigan. Plantar fasciitis is a condition I treat frequently, and I often see patients whose life is significantly impacted by the pain it can cause. There are millions of people affected by plantar fasciitis each year. Anyone who does any level of walking, standing, or running is someone who could potentially develop this condition. With this in mind, let's take a closer look at what is involved in these movements. When you walk, stand, and run, the muscles in your foot and lower leg are doing a significant portion of the work. These muscles play major roles in controlling stability, movement, and in generating and accepting/dispersing force. Imbalances, weaknesses, or stress in these muscles are commonly where plantar fasciitis stems from. In addition to muscle deficiencies, the foot's arches can also be a factor. Arches in your foot help distribute weight and absorb shock during weight-bearing activities. The medial longitudinal arch, lateral longitudinal arch, and transverse arch act as natural shock absorbers and reduce the impact forces on the feet and the rest of the body. In one day, the average person's foot absorbs roughly the same amount of weight borne by a fully loaded cement truck. An active individual, such as a runner, could be putting nearly twice as much impact as that on their feet in a day. With all of this force, the foot and the lower leg need to be adequately prepared for conditions like plantar fasciitis could occur. Younger and more active individuals, such as runners or athletes, are likely to develop plantar fasciitis due to the increased level of demands on the muscles in their feet and lower legs. But even if you are not an athlete, your foot still needs to be prepared to properly support and withstand impact. Older and more sedentary adults can often develop the condition as well, particularly adults who maintain a higher body mass index. Others likely to experience plantar fasciitis are those who are on their feet for many hours a day in environments with hard floors, such as factory workers, teachers, or nurses. Plantar fasciitis is a term for pain in the plantar fascia. Plantar fascia is an expansive connective tissue located on the bottom of the foot, spanning from the heel to the toe. It aids in stability and control of the foot and helps absorb the impact of our weight-bearing movements. Contrary to popular belief, plantar fasciitis is not directly caused by being flat-footed, having too high of an arch, or a condition that you can inherit. New research is showing that inflammation is also likely not the direct cause of the condition. I think it could be helpful to describe the condition instead as plantar fasciopathy or simply plantar heel pain. Activities like standing, walking, and running increases the tension and load in the plantar fascia. Activities that involve extension of the big toe, such as push-off phase and gait, and loading of the Achilles tendon, jumping, stairs, and weight bearing in general, all can affect the plantar fascia. So when this heel or foot pain arises, what do? For many years, aggressive soft tissue work was believed to relieve the tension or pain. Because of the dense nature of the plantar fascia, it would take much greater force to manipulate than what we can generate by our hands or tools. Thankfully, that much force is not needed to help resolve it. Physical therapy is perhaps the most effective way to resolve plantar fasciitis, because the root cause of plantar fasciitis is stress to that banded tissue and the surrounding areas. Addressing the reasons for that stress and better allowing us to tolerate that stress is going to be the most effective plan. The pain associated with plantar fasciitis relates back to an inability of these tissues to tolerate the stress and load that ultimately could be from weakness, imbalances, or tightness in the foot and lower leg. A physical therapist is going to be the ideal provider to identify this problem, as they are experts in evaluating, implementing, and educating while providing treatment and exercise to benefit the musculoskeletal system. Just as important, a physical therapist can also help with workload management, assist in finding the right footwear, and determine if there is a need for orthotics. At Full Potential Physical Therapy, we are dedicated not only helping you resolve your plantar fasciitis pain, but also giving you the tools and education you need to prevent that pain from returning. With plantar fasciitis, you can leave your program with confidence, knowing that you have the tools to treat any future flare-ups independently. So don't wait until your pain worsens. Getting started is easy. Just give our office a call. You can also request a free consultation through our website. We would love to help you get rid of your foot pain and get back to your life.